Hello everyone, and welcome to this audio podcast. Welcome to this audio podcast. This audio podcast is part of the Howl and Shiztorm. This audio podcast is part of the Sheep Mode and Atom. This audio podcast as part of the Mayhem Squad. This audio podcast as part of a Storm Robotics production. In this audio podcast, in following works, some fantastic works from C. Jefferson and some of the some student collaborators in around some retrospective works looking at in around and pertaining to Crohn's disease. This audio podcast will follow on and look at some of the some aspects in around the pharmacotherapy, and this audio podcast won't go into too much detail around drug names, drug brands per se, but just in around some of the sort of an overview in some of the drug classes, and the objectives of those particular drugs, the particular drugs that have been that are sort of evidenced to be sort of helpful, or sort of form sort of pharmacotherapy or treatments in for Crohn's, and then there will be a look at some where in around where literature has informed of where the where in around where literature has informed of particular examples of the characteristic of these particular drugs, of these treatments. So to begin with, in amongst the literature, there is in amongst the literature there is the indication that aminoglycosylates are useful in Crohn's recipients or Crohn's patients, and the main purpose of aminoglycosylates is that they have the basis to reduce where they have the basis to reduce the inflammation in the GI tract or gastrointestinal tract for mild to moderate Crohn's disease. So some examples that are amongst the literature under this sort of category of categories of drugs for Crohn's patients or recipients is sulfasalazine and oxalizine. So those are some of the examples of the particular pharmacotherapeutics or pharmacotherapies. Then there's corticosteroids, which reduce inflammation for moderate to severe Crohn's, and some of the examples include, for example, prednisolone and methylprednisolone. Methylprednisolone is more just to inform listeners and viewers that methylpred is more of a sort of a corticosteroid that is used in sort of more invasive, in more sort of in more sort of intense care, intensive and more intense care, intense cases of recipients or patients with Crohn's, since its administration is through IV or intravenous. So it is a more invasive form of pharmacotherapy or pharmacotherapeutic, as opposed to, for example, it's sort of a milder corticosteroid being prednisone. Then there's the drug classes of immunomodulators. So the basis of immunomodulators is that they prevent ongoing inflammation, and particular examples can include cyclosporine and or azathioprine. Immunomodulators have also a sort of a different name. These immunomodulators can also be referred to as immunosuppressants. So cyclosporin is an immunosuppressant that goes back to the 1970s, early 1980s, and azathioprine is has been evident in amongst the literatures going back as far as a similar duration. Azathioprine is sort of an immunosuppressant that is not as broadly used as much as it had once it has been as it has been in the past. So the immunomodulators are sort of or immunosuppressants in the cases of Crohn's disease or conditions may be sort of maybe those sort of examples of pharmacotherapeutics that specialists would prescribe and again, much like in where for example there would be where the recipients or patients are in more or have more severe where there are more severe cases of Crohn's sort of conditions. The corticosteroids and the immunosuppressants or immunomodulators have a similar basis. So corticosteroids, they work as a basis to reduce inflammation, and the immunomodulators or immunosuppressants, they also have the basis to prevent ongoing inflammation. So both actually work in sort of a in a sense of synchronicity. Then there's the pharmacotherapeutics, such as around the drug classes being antibiotics. And the antibiotics, they treat abscesses, and sort of those the narrowing, such as referred to in literature as in Crohn's, in the cases of Crohn's syndrome or Crohn's disease, such as fistulas, where there's narrowing referred to as fistulas and caused by bacterial infections within the gastrointestinal tract. The examples of these include metronidazole and rifaximin, and metronidazole and both rifaximin are sort of those sort of antibiotics or antibiotic relating or regarding pharmacotherapeutics that are used where patients or recipients have actual evidence of abscesses or sort of stricture or narrowing in around the gastrointestinal tract. Yeah. And then there's the basis of biologics and biosimilars, where the main purpose of such drugs, classes of drug, target specific proteins involved in inflammation. Whilst we know, for example, one of the biggest proteins in the body, generally speaking, is albumin. Albumin is sort of the main protein within pathophysiology, generally speaking. And then there are smaller proteins, which have different, which are from different sort of family elements of different family aspects of proteins within pathophysiology, and these proteins are in amongst can be involved in where they actually propagate and also are a factor in around inflammation. So the biologics and biosimilars are those sort of classes of drugs or pharmacotherapeutics that target those particular proteins that are involved in as part of the as part of inflammation or the inflammatory basis in around patients where there is GI or gastrointestinal and sort of Crohn's symptomology. The particular pharmacotherapeutics, for example, in literature, have been evidenced as adalimumab and certolizumab, which are both actually monoclonal antibodies, monoclonal antibody derived sort of pharmacotherapeutics, and they work sort of a little bit like immunosuppressants. They work a little bit like immunosuppressants or immunomodulators, and a little bit like corticosteroids, but not in this sort of direct sort of pathway as far as the mode of action is. And so those are just a few of the sort of biologics and biosimilars which are monoclonal antibody derived. Then finally, there's the targeted synthetic small molecules, which are classes of pharmacotherapeutics, which the main function, main basis is to reduce inflammation, and some of the examples include of pharmacotherapeutics include upadacitinib and tafasitamab, and these are mainly, as per mentioned, where the bases are the bases where they have the action to reduce inflammation. So that is just an overview of the different pharmacotherapeutics that can be used in Crohn's, in around Crohn's or Crohn's symptomologies, and C. Jefferson C. Jefferson and colleagues and student collaborators, when they developed this sort of original works, had actually factored in these pharmacotherapeutics or evidence these sort of pharmacotherapeutics really quite well for those who have such symptomologies in around Crohn's or Crohn's disease or Crohn's syndrome. So that draws this audio podcast to a close. This audio podcast as part of the Howl and Shiztorm. This audio podcast as part of the Ship Mode and Atom. This audio podcast as part of the Mayhem Squad. And this audio podcast as part of a Storm Lobostics production.